If you have questions about laboratory tests, you can contact me directly. If you've seen an article that says something about coronavirus, we've got a really talented staff, very knowledgeable staff that has years of experience that can answer almost any questions. You may also see some of our commercials that are coming out on Channel 7 and Channel 13, some of the billboards that we have going up talking about some of the new testing that we have. And one of the coolest features that we just started with is our direct-to-consumer. When I say that, it just means that you don't need a physician order to come in and get routine lab work. So if that's something that you're interested in and you get it back and you're looking at the test and you go, I have no clue what this says or what it means, and I would like some help. We have a platform that we've partnered with the telehealth group even before all the coronavirus to do lab interpretations. And so for the first 20 people that asked to do this, again, we are now offering the antibody test and the coronavirus test with our partnership with Mayo Clinic, and we hope to bring that in-house within the next month. But Mayo Clinic is a top 5 lab. Everybody knows the name. They're very quality, and they've been a great partner for us. And so for people in New Mexico that are looking for another option for lab tests, that's about as good as it gets. And we're really kind of fortunate to have put that together. They've been great. Their turnaround times are awesome. They'll answer questions. So it's been very positive. But if you want to get a test interpretation done, we have an app that your test result will be put onto, and then all you have to do is just say, I want an interpretation, and you can either chat with a board-certified physician, or they can just write up a little statement saying, this is what it looks like. You might be deficient in this, you might need this. But it's a super cool platform. I think it's a wave of the future. The days of, kind of the test taking so long and all the stuff that's, complicated to understand. I think this is where it's headed. So, and then on a cash basis, like I said before, lab test is very affordable on a cash basis. So you might go to the doctor and then all of a sudden you get a random bill in the mail and you go, why? Why did I get this? Well, the short and sweet answer is your insurance company isn't paying for a lot of this stuff anymore. And it's sad because you pay for insurance, you go to the doctor, and they should pay for this. In our state, health insurance companies don't want to contract. We're the only other lab in the state. It doesn't make sense to me why Blue Cross Blue Shield would not want to contract at a rate, especially now when there's limited access to care and we have the ability to do a lot of this stuff. We want to do it. We want to help out. We've reached out a number of times. So if you are also frustrated with this and you want this, do me a favor and call Blue Cross Blue Shield and say, we would like you to contract with Southwest Labs. I pay for insurance. I want to have options. We're willing to contract at the rates that the other labs are. And so that would do us a huge favor, also do you a huge favor. If you have questions about that, you can contact me directly, and I'll be happy to explain how medical insurance and billing and EOBs and deductibles and copays and all this super complicated stuff works. I understand this, and I empathize for people that get these because it's a very confusing process. And so the direct-to-consumer platform, that's why I say this takes the mystery out of everything. You know exactly what you're going to pay for. You know exactly what you're going to get. And a lot of times it's faster because you eliminate a lot of steps. You walk in, you get the test done, you get the result back a day or two, and then you can just hop on your cell phone, have a conversation, and get what you need and go on down the road. And if you haven't been getting routine lab work done, most people don't get it until they go to the doctor, until something's happening. It's a very cost-effective way. You'd be surprised at how inexpensive it is to get this done, and a lot of times it's cheaper than the deductible or the copay that you'll get if you haven't met that for any bill that you're going to get for your insurance company. So check out our new collection site. It's right off of San Mateo where it turns into Osuna and Jefferson. There's a Sweat Yoga, there's the Freeway, there's an Einstein Bagels and a Wex. We're right in that shopping center. It's a very clean location. The people that are in there collecting samples are phlebotomists They're all wearing protective gear. We're taking temperatures when you walk in the door. We only allow a certain amount of people at any given time in the facility. We're taking extra steps to make sure that you're safe, and they're doing a fantastic job. And really, when we talk about emergency services, there's no reason that if you need to get your lab test done, you can't come and get something that you need, especially since we're taking all of these extra precautions. So again, I said this before, I want to thank all the people that work with us, that are on the front lines, that are interacting with patients. It's a very scary time. It's a real thing that people aren't going to their physicians right now. And I also want to thank all the doctors that work with us, and the PAs and the nurses and the medical assistants and everybody that's out there really trying to help. There's not a blueprint for this, and they're there every day because they're important. And what I've heard from the doctors is they're very passionate about treating their patients, and they want to help. And it's been really cool to see that side of medicine that I don't think gets enough credit, where our physicians are really empathetic and sympathetic, and they really want to treat their patients. They want to help, and that's what they do. And kind of some of these constraints, it's been a big curveball to them. So I just want to thank all of our providers and our physicians that work with us. We appreciate you. Thank you so much for what you do. And with that, that's probably enough of me talking. I'm sure I said lots of funny things that'll be clickbait for my friends. Anyway, thanks a lot. Have a good one.